I've gone on a lot about how cells have to die, okay, that they're programmed to. Apart from those few immune cells we want to live for a bit longer, cells have a finite lifespan. What happens if they fail to die? And that does happen in a disease. What happens if you have a few more older cells hanging around a bit longer than they should? And that's actually not a problem initially, okay? A few more elderly in the community, you can imagine, that's not too much of a problem. And then, they start to get in the way a bit when there's too many of them. And productivity starts to suffer. Bone marrow isn't quite producing as many blood cells as it should do. And eventually the whole society collapses. It fills up with just cells that fail to die when they should. And the example of that is chronic lymphocytic leukemia, or there is a low-grade lymphoma. So these are cells where the gene that tells cells when to die, or the gene that we switch on in those immune cells because we want cells to live, gets switched on inappropriately in these cells. And they just don't die when they should. So this is normal, nice mature cells. Early disease, not a big problem. We can see it. There's a few too many of these mature cells. But with time, it just fills up the bone marrow and we get to trouble. Okay, and this takes years. Okay, so failing to die takes a lot longer to cause trouble than cells that will proliferate out of control and won't grow up. And then, you can take this analogy too far. What happens if the teenagers have a party? And some people in this room will be familiar with this. It's actually dangerous to teenagers have a party because the texts go out and you have the teenagers turn up. And what they do when they have a party is they actually damage the house and block the drains. And this is an example of multiple myeloma. And multiple myeloma is cells that are sort of partly grown up, proliferate a bit, and they damage the bones and the bone marrow and cause bone problems, and they can damage the kidneys. And here's a picture. This is a bone marrow with myeloma cells in it. These are not normal, okay, and they're filling up the bone marrow and stopping it from working as well as it should, not as badly as some types of leukemia, but they actually cause weakness of the bones, which can cause them to break, and it can cause, this is the protein produced by these cells which can clog up the kidney and cause that to fail. Okay, and there's various, some people get this and some people get that, and some people get neither and some people get both. But that's sort of the analogy, is sort of partly grown up cells getting out of control. And then I mentioned the boarding school. These are the cells over in the lymph node. What happens if they misbehave and they start to divide out of control? Okay, and what they do is they fill up the lymph nodes and they can cause trouble, and they can also come back and cause trouble in the bone marrow. And this example is actually lymphoma. Okay, this is cancer of the lymph nodes. So the cells started off in the bone marrow, moved out to the lymph nodes to be educated, and if they go bad there, they actually can cause problems in the lymph nodes. They can actually come back and cause problems in the bone marrow. So people with lymphoma, we often do a bone marrow test to see if the disease is spread to that, back to the bone marrow. And that's a normal lymph node, and it's a nice structure. It's got these little things called follicles, and it's got this sort of normal cells. This is a normal, and they tend to be out on the outside of the lymph node. And this is a high-grade lymphoma where it's the immature cells in the lymph node that go wrong and start proliferating too much. And you can see this is just completely replaced by these cells. Okay, that's a high-grade lymphoma. And this is a low-grade lymphoma. We call it follicular. You can see there are follicles, but they're all disordered and out of control. And this behaves in a sort of, this is caused mainly by cells not dying when they should. So it takes quite a long time to cause trouble, a bit like chronic lymphocytic leukemia. So in summary, bone marrow is a complex tissue. It's made up of this hierarchy of cells, including these rare stem cells, which you absolutely need, but they have to be able to renew themselves. You have these immature cells in the bone marrow which can divide enormously, turn one cell into millions of cells, okay, over the course of a few days. And they also have to grow up into these mature blood cells. The red blood cells, which carry oxygen around the body, the white blood cells, which fight infection, and the platelets, which help to clot the blood. The control of that is largely achieved by special hormones called cytokines. These are these signals that come from outside the cells. They bind to these proteins in the surface of the cells called receptors, and they switch on. They send signals to the nucleus which change the expression of genes, and it makes cells either divide, stop dividing, die, become active. Okay, and bone marrow diseases arise from the failure of these basic processes. And it's due to a change in the way genes are expressed in cells, okay? And that can lead to excessive proliferation, what we call the myeloproliferative disorders, where you produce mature blood cells, just far too many of them, okay? So there's no problem with them growing up, there's no problem with the stem cells, they're just too many of them. You can have cells which fail to grow up, that's the acute leukemias. You can have cells that fail to die, that's the low-grade lymphomas and chronic lymphocytic leukemia. And you can have sort of abnormal behaviour and failure of growth, which is these diseases like multiple myeloma and aggressive lymphoma, which have features of some of these other things as well. And as an aside, it's pretty rare, and it's not actually a form of malignancy, but aplastic anemia, where you lose your stem cells, you lose everything, okay? And that's all I've got to say, so thank you very much for your attention. So I'd be happy to answer questions. In Auckland, I got a question on epigenetics, so I don't actually know what epigenetics, well, I sort of do, but so as long as it's not about epigenetics, I'd be happy to answer any questions.
Right. I got multiple myeloma
Yep.
4 years ago.
Mm.
I was over 70, so I couldn't have a blood stem cell.
Yep.
Now, what's the cut-off? Is it because I'm too old?
It's to do with a stem cell transplant is useful to treat myeloma. We don't think it's curable with a stem cell transplant. We think it prolongs the remission that we get with our chemotherapy. And the reason we have a cut-off is not because we're ageist or we think 70-year-olds don't deserve it. It's because in the studies that have been done, the outcomes with the transplant are better in people aged under 65 to 70, and it doesn't seem to achieve much in those over 70. The toxicity or the problems as you get a bit older outweigh the benefits. That's why the decision is made along those lines. We used to say 65, we sort of do a few between 65 and 70. Some countries, in the United States, they do them in older people, but in the United States, the incentive is they get paid for doing it, and the more they do, the more they get paid. So we don't have that here, fortunately. In Europe, they tend to be much more conservative, and they tend to do it up to about 65. So that's the reason. It's not, I mean, we don't distinguish on age in terms of whether older people deserve treatment or not. It's really in terms of what the best treatment for a person is. And the studies have not shown a lot of benefit in older people for stem cell transplantation, whereas they have in younger people. Sorry?
Same thing with bone marrow.
Bone marrow and stem cell transplant's more or less the same thing. We used to talk about bone marrow transplant because we, before we worked out how to get the stem cells out into blood, to get stem cells we had to we had to actually give people a general anaesthetic and get about 1 litre of bone marrow to the back of the hips, and some people here will have had a couple of mils taken out, so you can imagine what taking about 1 litre out feels like. When we've worked out how to get them out to the blood with these hormones, the GCSF, we tend to prefer to get it out of the blood. But it's the same, it's a stem cell transplant, whether we use bone marrow as our source of stem cells or peripheral blood as our source of stem cells. You may be alluding to the possibility of using your own stem cells or somebody else's. Now, you can use someone else's stem cells to cure a lot of these diseases, because you can the danger with doing a self-transplant is you're taking the patient's own stem cells, which may be contaminated by the disease that's in the bone marrow. And using someone else's stem cells is very attractive from that point of view. The problem is, even if you get a very well-matched donor, you won't be the same. Unless you're identical twins, that donor won't be exactly the same as you. And there's this problem called graft versus host disease. So if you stick my brother's kidney into me, my body will try and reject that. If you stick his bone marrow into me, his bone marrow will try and reject the rest of my body. And if it's not a good match, bone marrow has to be very closely matched, much closer matched than, say, for a kidney or a heart transplant or a lung transplant. And that problem, that graft versus host disease, becomes much more of a problem as people get older. It's a bone marrow transplant from someone else is fairly hazardous. It has a significant risk of causing death, and so you actually don't go into that lightly. You have to have a disease that has causing major problems, or you'd predict is going to cause major problems in the future, to take that risk. Whereas a stem cell transplant using your own bone marrow or your own stem cells is much safer. And so we do that even when we know it's not curing the disease, but it's prolonging the remission that we can achieve with chemotherapy.